Hi, I'm Dr. Steve Pinney, and in this video we're going to review peroneal tendonitis. Peroneal tendonitis occurs when the two rope-like peroneal tendons become inflamed from overuse or local irritation. The tendonitis leads to pain and swelling in the outside of the ankle that tends to worsen with activities. So why does peroneal tendonitis develop? To understand why, it's important to understand the function of the peroneal tendons. Both tendons, the peroneus brevis and the peroneus longus, originate from their respective muscle bellies on the outside part of the lower leg. Contraction of these muscles applies force through the tendons to help move or control the foot. Specifically, these muscle tendon units can evert the foot to the outside or equally commonly resist inversion of the foot to the inside. These two tendons play a critical role in stabilizing and moving the foot during walking and running. These tendons are often subject to forces that are a number of times body weight. What is interesting is that these forces are much greater if the foot is in a varus position. Now, varus is a fancy medical term that essentially means that a particular body part slopes inward towards the midline. In this case, if the hind foot tilts inward, it is said to be in varus alignment. This hind foot position is commonly seen in people with a high arched foot. Therefore, individuals with a higher arched foot are more likely to suffer from peroneal tendonitis as they age. With the peroneal tendons being subject to considerable repetitive loading over time, wear and tear on the tendons is common as people age. Think about a rope that gets continually loaded over many years. Eventually, some of the fibers of the rope will fray. Microscopic injury is the equivalent of fraying for the fibers of a tendon. These microscopic injuries to the tendon cause the body to send increased blood and inflammatory mediators to the tendon in an attempt to heal it. If the microscopic injuries persist, the tendon can eventually become symptomatic with pain and swelling. This is tendonitis. Although it should be noted that wear and tear of the tendon often occurs without any symptoms. We know this because MRIs of the ankle performed on patients in their 30s, 40s, and 50s who do not have any symptoms at all often demonstrate microscopic injury, swelling, and even partial tearing of the peroneal tendons. Peroneal tendonitis can usually be diagnosed just by examining the patient. Patients with symptomatic peroneal tendonitis will usually have localized tenderness and some swelling in the area around the tendons. It's important to assess how strongly the patient can evert their ankle. Weakness in this motion may suggest a significant tearing of one or both of the peroneal tendons. Plain x-rays of the foot and ankle can help to rule out other potential sources of foot pain, such as arthritis of the ankle or the other hindfoot joints. Weight-bearing x-rays will also identify the foot alignment, such as a high arched foot that would predispose to the development of peroneal tendonitis. However, x-rays will not give any detailed information about the status of the tendons themselves. An MRI can help visualize the soft tissues around the ankle, including the peroneal tendons. However, ordering an MRI should only be considered if the results are going to change the management of the patient's condition. The reason for this is that, as previously mentioned, many asymptomatic patients will have abnormalities associated with their tendons that are identified on MRI. In other words, it's not enough to find an abnormality associated with the peroneal tendons on MRI. This is common. The MRI abnormality needs to actually be the cause of the patient's symptoms. MRI findings will often demonstrate swelling of the peroneal tendons, synovial fluid around the tendons, and even longitudinal tearing of the tendon fibers themselves. These findings are common, particularly as patients get into their 40s, 50s, and 60s. And there are many patients with these findings on MRI that have no symptoms at all. Most patients with peroneal tendonitis can have their symptoms considerably improved or eliminated with conservative treatment. The goals of treating peroneal tendonitis is to get the pain symptoms to settle down and then gradually increase the patient's activity level back to normal. This is often done with an initial period of relative immobilization by limiting activities and possibly placing the patient in a walker, boot, or brace. Anti-inflammatory medications may be helpful if there are no contraindications. Physical therapy and a home exercise program are usually key elements of a successful treatment plan. The focus of therapy is on decreasing local inflammation, mobilizing the tendons and soft tissues, and gradually strengthening the muscles that control the ankle. Often 2 months of therapy or longer is required to successfully resolve the symptoms of peroneal tendonitis. Comfort shoes and the use of ankle bracing may also be helpful in resolving tendonitis symptoms. Corticosteroid or platelet-rich plasma injections can also be quite helpful in decreasing the pain from inflammation. However, care must be taken with corticosteroid injections. They work great in relieving pain in the short term, but these injections can weaken the tendons and increase the likelihood of a rupture in the future. Surgery for peroneal tendonitis is reserved for patients that have ongoing symptoms in spite of optimal conservative management, or patients who have clear weakness with an associated attritional rupture of one or both of the peroneal tendons. Surgery usually involves cleaning out the tendons by removing scar tissue that forms around the tendon. This cleanup procedure is called a debridement. If one of the peroneal tendons is partially torn, it may be able to be repaired. However, if there is a complete or near complete tearing of one of the tendons, the end of the torn tendon that the muscle is attached to may need to be transferred into the other peroneal tendon. Finally, many procedures designed to address peroneal tendonitis require repositioning of one or more bones of the foot in order to fundamentally change the shape of the foot. This is often done to correct the forces that led to the development of the peroneal tendonitis in the first place. The recovery from this type of reconstructive surgery will often be longer in order to allow for the bones to heal adequately. I hope that you found this review of peroneal tendonitis to be helpful. For more information, click on the description below. Wishing you good foot health, I'm Dr. Steve Pinney.